Thank you, Dr. Jayantan. Respected teachers, senior ophthalmologists, my dear friends. So the topic given to me was choosing the right microscope. And just a brief introduction. We all know as an operating surgical microscope is the most important optical instrument in the modern era of ophthalmic surgeries. So it not only provides magnified and illuminated high quality images in the small ophthalmic structures, and being binocular, it gives additional benefit of high quality stereopsis. So I thought, being the last speaker of the last day of the session, so I thought we'll do something different. So rather than me, we have the basic principles of the microscopes and all different parts of the microscope. So we have a very good audience here for the last session. So it'd be more appropriate and more practical if we could take any questions from you and then be able to answer. Because in the panel we have one cataract surgeon, we have a pediatric ophthalmologist, we have an oculoplasty surgeon and a cataract surgeon. So if there could be any questions or doubts regarding anything related to microscopes, we'll be happy to answer rather than just talking about principles. We all know it's made of 4 parts. It's got the basic optical system, the illumination system, the arms or the hands, and the stand and the foot pedal. And then basically it is divided into 3 groups. You have the basic microscopes, then you have the mid-range microscopes, and the high-end microscopes, which have other attachments like the Callisto, the OCT guided microscopes. So it'll be only appropriate, like if you have any questions from the audience regarding microscopes, the companies, the cost, or where to use which microscopes. Nobody? Yeah, good start.
Hello, sir. It's a very basic question. I work in a government setup, sir. I just started up, so I want to know about the basic microscope needs. What do we have? I am having Apaswami Brilliant Plus, an old microscope. I've been asking my seniors. They have told me, advised me to use Retroglow or Omniglow, whatever it is, that will add up enhancement and assist in doing surgeries. But I have done some research on these Retroglows. They decreases the stereopsis, they say, sir. So
Yeah.
can you comment on that and also tell me about? I'm planning to buy a basic microscope. So which microscope I should purchase? Like,
Excellent. So the first part I'll answer. The second part, I think Atik has got the attachment, so he'll be able to answer. So basically, what we mean by a basic microscope is, does your microscope have the XY axis control? Yeah, and it is only useful for anterior segment. Like it does not have an attachment where you can later on fix a biome or have attachments, because that will not bear the weight. So basic microscope, as you said, you already have Apasami, then we have the Zeiss 1FR model, then we have the Topcon OMS5 model, and then we have the Leica. So what basic is, it's very good for cataract surgery. And as you rightly said, the glow, all microscopes have a good amount of red glow. I think now it is fantasized by the other companies that you need more retro glow, but then there is less stereopsis, and also the depth also decreases when you have this enhanced glow. And that's what Atik is actually having it, so his experience will be better on this stuff.
Actually, I will say that there is not much of loss of stereopsis, but the issue was I tried 2 equipments. One brand, I had quite a lot of diplopia. I was not able to focus well. Mainly when we do the chopper, I was seeing 2. Then I called the company person and asked, this is how this system works. Then I tried another demo with another company, and I was comfortable with it. There was not much of diplopia. Loss of stereopsis, theoretically it is there, but when you operate, you're not seeing much, sir. I was thinking of upgrading my microscope. I have a 1FR Pro, and the next level microscopes were costing more than 30 lakhs, and this device costs hardly 1.5 to 2 lakhs. What I have is the Orolabs Omniglow, and it's been more than 1.5 years. Honestly, I've been quite happy with it. I'm happy that I spent 2.5 lakhs and not another 35, sir. You take a demo, sir. No. You tell them to put it in your theater. You do 3 to 5 cases.
Exactly, that's what I also wanted to stress on. You need to have a hands-on experience in your own OT, in your own surgical chair with your patients. See, I believe in something like what they call for the multifocals, the neural adaptation. You need to experience it in your OT at least for 2-3 sessions, and then go for a decision. You can talk to your friends about the financials, but the experience of operating, it comes only for you. Your friend could be an emmetrope. His experience will be completely different from when you have a refractive error. So a friend who very good mentor who's 45, his experience will be different from a pre-presbyope. So you need to really experience, never go by just by the words. You need to have a 3 sessions, operate. And regarding the stereopsis, once you start using it, definitely you'll get adapted to it. Definitely there will be a loss of, so one advantage will come with then another disadvantage, but the neural adaptation will definitely help you in the long run. So all that matters is your experience with that particular. And when you're taking a demo, one suggestion which I would like to do is, never operate one OT with OmniGlow, compare it without an OmniGlow on the next sitting. So never keep trying it up. Use OmniGlow for 3 continuous sessions and see how it works. When you keep, it holds good even for your like phaco machines also. When you have 2 machines and trying it, you'll never be comfortable with either machines. Use one machine for 3 sessions continuously, look at your experience, and then decide. That's what I would like to suggest. No. So the question is like, when you have a depth perception issue, do you want to switch off when you are doing the phaco emulsification? No. So I would like to suggest from end to end, you switch on and use it. That's the best part. As again said, like definitely with your neural adaptation, you'll get used to it. When you keep switching on and off, definitely it is going to be an issue. For example, at a rare instance, if you're going to have a PCR, it is going to be a difficult part for you. So right from end to end, you have to go with it.
Thank you, Jayant. Any other questions? Because I think because it's instruction code, we can make it really interactive to learn from everybody. Because each practice is different and each one's use it for a different purpose. Yeah. So we can all open up so it become a better discussion actually.
To start an OT, which is the best microscope?
Yeah. So everybody goes through a journey. So we have also come through that. So what they call by basic is basically in the end of the day, it comes to the cost as far as we are concerned because we are setting up our practice. So choosing among the basic, I think that as already said by the previous speakers, you have to experience it firsthand because we can, as I already said, see Apasami is got, Leica is got, Topcon is got, and there are a few Taka is there. So unless you have a first-hand demo and how which ones you're comfortable with, because within them we cannot compare, but because ours is a training institute, so we have from the basic to the high-end microscope. So most people when they come, they ask us. So I say that it's very difficult to compare a basic one to a high-end one. It's like comparing a Maruti 800 to a Ferrari. Definitely advantages are there. So you can't say there are no advantages. So you're supposed to compare within the same class. So starting off, I would always suggest start with the basic microscope because you start doing your practice as it builds. And then you go to the intermediate where you have the side code attachment. Then you can put on your recording systems. So that, and the optics are also slightly better actually. Definitely better. There will be a difference. And then upgrade it further. So that's how I would suggest. So anybody has a different opinion on that can share.
So to start your practice, basically I would recommend to go for better microscope, not the higher end ones, but a better microscope. Mainly because of 2 reasons. One, your microscope's life is going to be larger. So you're going to use it for a longer time. Phaco machine, take it from me, not more than 7 years. You cannot use it. Either the technology will change or you may be looking for a better options. So, and of course, to start your practice, you may not even invest in your phaco. If you are doing a very good small incision cataract surgery, you can even implant premium IOLs in a small incision cataract surgery. So you really need to invest in a very good microscopes. And phaco machine, as you know, we are going to use that only for the phaco part. But right from your incision till you put an IOL, microscope is going to be come handy for you. So microscope is one thing you really need to work on. So cost factor, again, you can think of all the indigenous microscopes, get a demo, and then you can work on it. Few of the microscopes have a few issues like it depends on the place where you are practicing. For example, if a microscope has got a fan which is attached to it to keep the dehumidifier, if the place where you are practicing has got a high humidity, there will be a little amount of moisture that is getting in, and if you are using it infrequently, there could be a fungal growth in that. So the maintenance of the equipment is also something you need to take care. So all that comes in that range is not the same. So you need to think about the optics. You need to think about the attachments that is going to come in it and the maintenance part of it, especially pertaining to your own OT setup and your place. So that also needs to be taken into account when you're having your cost factor worked on, because a 6 lakh microscope, if it needs lot of maintenance, it is going to eat a lot of time. So better to spend on a few lakhs more and then have a maintenance free microscopes. So you need to talk to the company person about that also. Stepwise, the question is, how do you compare a stepwise magnification with a continuous zoom? Basically, I believe like pre-presbyopes, your step magnification definitely is good, but once you become a presbyope, it is always better go for the continuous zoom. And continuous zoom has got other advantages when you are going for a recording, all the other purposes, definitely, because recording system is very important. I don't recommend high-end recording systems, but definitely you need to have at least a small indigenous recording system initially to start your practice. Always audit your own surgeries. That's how you improve every day. To even if you want to go for a premium cataract practice, your surgical steps has to be refined every day. For that you need a recording system. So see for the compatibility of the recording system in your microscopes. That is also very important. So continuous zoom, yes, if that's an option, if that is inside your pockets, the thing, definitely go for it. Step definitely has its own disadvantages, because from zero point 0.6 it'll go to 1. So what I feel is like after 36 you'll be more comfortable using a 0.8 rather than 0.6 or 1. So once you have a higher magnification, the field will come definitely will become very smaller and your depth is going to be not that good. So always it is better to go for a continuous zoom rather than on a step zoom.
Thank you, Jantan. Nick?
Sir, I have
That's
two
a nice
OTs.
question.
One is in
I'll come.
city center, and the other one is in peripheral center. In city center, I am working with 1FR, JS 1FR. It is pretty good, no problem with that. In the peripheral center, I am working with Takaji, which is old one, old microscope. Because of that, its red glow is very poor. So in doing SICS, I have no problem with any microscope. But with FACO, as we are going to posterior capsule, near to the posterior capsule, glow should be there, red glow should be there, which is deficient in a Takaji microscope. So should I go for Omni glow, or should I purchase a new microscope like a Topcon or something like that?
Sir, if your Takagi is actually working well, if the illumination is good, if there is no maintenance issues, if the optic is perfectly maintained, you have a tiltable optics, you have an XYZ zoom, don't go for a newer one, sir. It's better to invest on an OmniGlow and then go ahead with this procedure, because that's
thank you, sir.
okay, sir. There's one more question, ma'am. Okay, so ma'am's question is, is it better to buy a second-hand, higher-end equipment or go for the lower-end, newer ones? That's $1 million question. I think.
I think with my experience, whoever is starting off practice, go with the new ones. Don't get tempted with the refurbished ones. It's same like cars, because you don't know how the other person is used. It is not according to the number of years. It doesn't mean if it is a 3-year-old microscope, it's going to be better than a 7-year microscope. As Jensen said, the previous models are all very sturdy. So we still have microscopes which are 10 years old, 15 years old from Hack Street and Lumera in our practice. But the newer ones that are coming don't last that long. So my suggestion as far as equipments are concerned, when you're starting your practice and it's going to be a single equipment investment, it should be only new, because as Jayantan said one point, what you buy is going to last for the next 5 years. But when you buy anything second hand, you will have starting trouble from first year. Then you will have to maintain it. Then you're going to spend changing one part, because one day you will have the light system going, the other day it might be the optical system. So each time you will be more spending time and headache on repairing those things, which is not required when you start your practice. So I would always recommend new ones. When you're going for the second microscope, you have become bigger, so you need 2 OT rooms, you need 2 ARs, you need 2 A scans. That time maybe probably you can think of these refurbished ones.
So I would like to accept his answer. See, basically, just remember one part. A person who's going to sell the machine, they'll be selling for the reason of upgradation. Like only 1 in 10 of the people will be upgrading to a higher end and they'll be selling. If I'm planning to sell it off, it says that there's a fault in it. So I'm not happy with it. When I'm not happy, then naturally I had a word from my father. My father was an ophthalmologist. He said, like, never give your equipment as a second hand, even free of cost, to any of your friends, because that is going to cost your relationship. Because when you're trying to sell it, definitely it is not a new one, or it is definitely going to be a fault. The day one you get the machine inside, there couldn't be a big issue. It holds for any electronics. So definitely
I think
it's
Pratibha
better
wants
to
to
go for
give
the
some
newer
highlights.
ones.
I have a doubt. I'm not. I mean, I don't know much about finances, AMC, CMC. I feel I find a lot of youngsters also. So, I mean, you people can guide us. Like, what should we exactly see? What should we go about with looking about the AMC charges or CMC charges? Like, can you highlight in
See,
microscope?
for
It is not.
microscopes, I think it is usually not needed because nothing usually goes wrong for the first 5 years at least, except for the bulbs that we have to maintain and a regular service. I think for phaco machines and vitrectomy machines, it's required. Atik?
Just one shock that I got. I for servicing my Zeiss microscope, I called Zeiss person to come and do it. That was the first and last time I called them, just to service it, to clean the optics, and to ensure it runs. I was charged 45,000, way higher than my surgeon's fees for about 4 to 5 cases. So never do that. There are a lot of people available freelancing who will be able to do a very good job for 5 to 6,000, maximum 5,000. They will be very happy you pay them 5,000 for that half an hour, 45 minutes job. Only thing with microscope, it's fungus issue is one problem. I'm from Chennai. I think Cochin also there will be a lot of humidity related issues. So you close your microscope, fungus is an issue. You don't operate for 10-15 days. During COVID time, we had that issue. I shut down for 1 month and that was happening. Otherwise, AMC, CMC for microscope, I don't think it is needed. Definitely microscope will last for ages. It doesn't go off at all. I don't know about the life of LED, but the previous bulbs, it fuses, you change it, that's it. So AMC, CMC is not needed. I call them once every 6 to 7 months. I have a date when I have cleaned it. So after 6 months or so, I do it. Problem is I fitted OmniGlow. So cleaning the lens is not possible without removing that basic device. So it looks a little fragile. It doesn't look solid. And the weight of the equipment has increased. So I ensure they come, they check the screws, tighten it, and then go. Otherwise, that up, down, and XY, there is a lot of load because of that extra gadget and the recording system which is attached. So I call them once every 6 months, and it all depends on how you use saline. Sometimes when the assistant pushes, no, that is where it issues. So I tell them not to put saline. I use only visco. The cleaning again causes damage in your optics. The way we clean, it causes the coating to peel off, and using alcohol is another issue which I found. We should not use alcohol based swabs to do the cleaning. It is advisable to just use the blow and clean technique where we don't peel off the coating. So that was a hard lesson that I learned in the previous microscope. Because of using alcohol based cleanings very aggressively, the coating peeled off.
Maintenance part, definitely there are two things which I want to add. One, definitely don't use an alcohol based cleaner. It is better to avoid physically also rubbing it. Always just blow off the dust what is available. One. Second thing is, as I was mentioning, there will always be a fungal issue with the microscopes, because there will be always a fan which keeps cooling the head. So all we need to do is, even if you are infrequently using, for example, like sir said, like if it's a peripheral center, you're going to operate just 2 days a week. Every day it is always better, just keep the microscope on. The light should be on. The heat will actually destroy the spores. If it is kept ideal, then definitely. Third thing is, if you are using for the cleaning, if you are using any sprays, whether it any aldehyde based sprays, your microscope head has to be covered, because this gets into the microscope, the fan of it, and that's when it goes off easily. So whether it is formalin, whatever we are using, it is always better clean the microscope exterior, cover it, and then use the sterilization methods, whatever you're doing for the theater.
Sir, my question was with cleaning also. Suppose, as sir said, that after 6 months he ask someone expert to clean the lenses. But in the meantime, sometimes after 2 or 3 weeks, if we have to clean the optics, with which solution or chemical we should clean it? Only with that? Okay. And should we use tissue paper or any?
It's always better to use a lint-free cloths. A lint-free cloth, and it is always better. Most of your gauze we cannot use. Most of the companies, like if you have an optical shop, the SLR, whatever it is, I don't know financial interest. All these branded, they'll give a cloth which will be of very good quality. Heine, whatever it is, that cloth will be totally lint free and that will be scratch proof also. So it is also important to keep that cloth safe, because if you're keeping the cloth elsewhere, you can there will be a dust on it and you will be scratching the optics. So the cloth has to be properly maintained. That's why I said SLR, because they give it with the plastic covers, pouches. You can keep it in the pouches and keep it away. So